Quite frankly, these are scary times, very scary times for most of us, all of us actually. And there are lots of questions, lots of concerns, and all kinds of information coming from different directions. And keeping up with growing list of available resources, trying to find the latest school updates, or just trying to figure out where to get accurate health information has proven to be quite a challenge during this time. So today, we are so excited to have live participants on Detroit Public Television, Facebook Live, on the phone, and here with us on Zoom for this webinar.
There are about 14 um, conventional community partners that we're probably going to continue to serve. What they're going to do is also go into a kind of drive-through drop-off format that allows everybody to have the least amount of touch points. We'll also do that at each of our 15 sites. The idea here is from our dry repack, we'll send a truck, and from our cold repack at Oak Park, we'll send a truck. And those 15 sites will be served once per day, and they will get about enough food for 700 families. We intend to put together, we're organizing boxes right now of about 30 pounds a piece of a mixture of things that we typically get from our community partners. And then in our cold giveaway, we're going to be giving away those box lunches for the children. We will be in Gompers. We will be in other rec centers across the city. And we'll give out the information about where we'll be as we complete and solidify these plans. But between now and Monday, we'll let everybody know where they can go to get food.
There will be a regional drive-up testing site opening in Detroit as a result of the cross-county city and health system partnerships. They do expect that testing will be done from Monday to Saturday, 7 a.m. to 6 p.m. at the State Fairgrounds in Detroit, starting tomorrow, Friday, March 27th. Test results are expected within 5 days. Individuals that would like to be tested must have a screening from their doctor, a written doctor's order, or a prescription, as well as making an appointment.
State MSTEP testing. We applied to the U.S. Department of Education for a waiver last week for the federal requirement to do annual state tests. We have received that waiver. We still need a state waiver from the state legislature. It's hard to imagine the logic of doing state testing in the midst of a public health crisis, but we do need state legislative action in this regard. Graduation requirements. Every senior who is on track to graduate before this crisis should graduate. We are committed to making that happen. If there is the requirement for state legislative action, we are going to work with the state legislature to make that happen.
And we have to make sure that all school employees are getting paid. And all teachers are. Most support staff are. I think there's probably a few examples of support staff who are not called into work not getting paid, but everyone should get paid. And more than that, what we're fighting for. And some districts are doing this, that everyone gets paid. But if I call you in to prepare and get food to kids or whatever else I call you in for as an hourly worker, you get overtime. And some districts are doing that. And I think that's the exact right, fair thing to do that we're fighting for.
The reality is I as superintendent, do not see this pandemic calming until May or June at best. And so I'm advocating for the state to announce a closure of schools so we can plan accordingly, continue online learning, not required, but enrichment, so we can focus on preparing for the summer, the fall. In addition, and I know other people are working on this, including myself, we need clarity from the legislature that we will be funded for 180 days and per pupil funding will not decrease. But the governor or the legislature has to act and give guidance so that we do not have a financial crisis down the road. I would rather announce the closing of schools so that our teachers can shift to interacting with our students more one-on-one, through FaceTime, through Teams, through Zoom, and other ways if the technology is there in the home. And I know that's a legitimate challenge, but for some we can work through that. Others we won't be able to. But that's one of the reasons why I want to shift, because then teachers can shift their mentality and their focus as well easier if we know this is where we stand in the next couple of weeks.
I want to give a special notice for all of the school districts. I know there are several that are listening. We are also taking applications from school districts, from the ISDs. We have received so many questions around the digital divide, getting the technology needs. So we are having constant conversations, working with some of our businesses who have offered pro bono services to help with the re-imaging of laptops. And we're also working across multiple agencies to make sure we're getting that technology in the hands of our families.
As an organization, even on a statewide basis, working with the authorizers, we are collaborating with all the schools across, whether it's a district school, private parochial, charter schools. We're sharing best practices, we're sharing resources. Those that have already had and built some expertise, whether it's digital engagement, maybe it's language, maybe it's figuring out how to best serve students that may be homeless or may be at risk in some other way. There are people that have expertise in all these areas. We're sharing and cross-referencing that expertise with people who may not have it and are going to need it ASAP.
So my role in all of this is really to not recreate anything that's been done, but to create space and spotlight for those who are around the city, and making sure that our children have what they need. That has turned into COVID313.org. It's something I encourage you to go in on your phones. It's meant to be mobile, not necessarily on a desktop, so it looks best on a phone. And what that site is, it's meant to be a hub to avoid sort of the runaround that happens when you're trying to find information at this scale. All of that content is curated from this partnership here, the coalition that's developed in response to all of this as it relates to serving children and youth and families. We do our best to link you to the most reliable and actionable resources. Everything is sort of crowdsourced, and in that way we have named experts in different topics, different buckets, to make sure that folks are looking out for the most important information as it gets online. So we are not here to spam you or just add another news stream. We want to make sure if there's something that a parent or someone connected to a school child in the city of Detroit needs to know, we are able to get that out to you.
We want to make sure that if you are a resident of Wayne County or a resident in the city of Detroit, that your water is on. We also want to make sure that your utilities are on, meaning your DTE bill. We want to make sure that that's current. If you're having an issue with property taxes, we can address that. Please call our Wayne Metro Connect Center. The phone number at the Wayne Metro Connect Center is 313-388-9799. We have staff standing by to take your calls. Funding is available. The wait time for a call is about 1.5 minutes. So please just stay patient if you do call us. We will get you enrolled in that program, and we will get your water restored.
As you can tell, there's a lot of information to give, and there are a lot of questions that we all still have. That's why we'll be here every Thursday from 12 to 2 to bring you the most up-to-date information.
Detroit can stand strong. That with our families, our children, and our community, we really believe that we will meet this challenge and come through it. And perhaps even we'll appreciate each other a little bit more as a result.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.